everybody. Thanks for joining me for episode 20 of Jillian's Clinical Corner. Today, we're talking about something that is actually pretty present in the news and media right now, and for good reason, and that is mental health. So, the great Yankee player Yogi Berra once said, baseball is 90% mental, the other half is physical. I know that this is one of his maybe funnier quotes because that doesn't total 100%. But what he said is actually really true. A huge part of life is mental. Sports is a place where mental health has been talked a lot about recently, with huge athletes like Michael Phelps talking about how important it is. We're at the time of the Olympics right now, and everyone is talking about Simone Biles pulling out of her events in gymnastics for the sake of her mental health. So, what does all this talk about mental health and sports have to do with Clinical Corner? Well, this relates to ABA too. I actually think within our field, mental health is one of the most important things we can do to be good clinicians. There are two areas of mental health really within the field of ABA to discuss. The first is behavior analysts considering the mental health of our clients and our clients' families. This is an area that is currently being talked about through trauma informed care and acceptance and commitment therapy, or ACT. It's no secret that in our education to become a BCBA that we're not necessarily taught about thinking about the mental health of our clients. I myself thought before that this is outside of my scope, not something that I'm educated in, and not something that informs behavior. However, I have since learned more about ACT and more about trauma informed care, and I can see how all of these pieces work together. It's important to mention that I'm not suggesting I counsel my clients and act as a psychologist. Those are two different things. But you can incorporate and educate yourself on trauma informed care and ACT training as it relates to ABA and make your clinical practice much more successful. Trauma informed care is so important because you never know if a protocol you're proposing may re expose someone to a past trauma. You might feel as though, behavior is behavior, which is true. I can agree with that. But if your intervention is not successful and you find out that you're causing your client with post traumatic stress to re experience trauma, you may actually be causing more harm than good. You could start to learn more about your clients by incorporating these strategies into your initial family interview, so that first initial meeting, and by asking meaningful questions about your client's learning and past history. Now, this clinical corner is certainly not enough to train anyone on trauma informed care or on ACT, but this is a good spot to kind of advocate for you to include these strategies into your clinical practice and to really go learn more about it because there are certainly plenty of continuing ed opportunities for BCBAs in both of those areas. The second is behavior analysts and therapists considering their own mental health. So, our work is very personal. First, every person is in this field to help the individuals that we work with and their families. Even though we try to always keep, obviously, a very professional line, we are often very close with our families and want to make ourselves available to them all the time. So each person I work with and that I know in this field is completely devoted to their clients. They think about them often, they work on their programming, they make updates and changes to their materials, they do things above and beyond in non billable time, well and above what insurance has approved, or sometimes what they're even paid for. This is all in the name of providing a high quality clinical service and the best that we could do and be for our clients and their families. This makes us excellent clinicians, but it can also be really all encompassing. What are we doing for ourselves? What are we doing to separate ourselves from our jobs? It's possible to be devoted to our clients and our jobs while also taking our own mental health into consideration. It's okay to set work hours in which you will respond to client calls, create work materials, update programs, and check emails. Try to create separation for yourself by not checking your email or even by shutting off your phone during your non working hours. You can let families know when you'll be able to be reached and the best way to contact you. It's okay and it's actually very professional to create boundaries of when and how you can be reached. Now that you would have established some time barriers, what do you do in your time to take care of your own mental health? I've spoken to a few people about this and heard a few common responses, such as they do yoga or exercise, they meditate, watch TV, go to the beach. For this, of course, there's really no right answer because each person is going to find what works best for them. Personally, my New Year's resolution was to meditate every day. I made it about 10 days, but then I realized that doesn't actually relax me. Just because many people recommend something doesn't mean that it's right for you. What I found that actually helped me relax, surprisingly, was baking. I also love watching some TV, playing with my kids, and taking walks. You never know what you might find when you give yourself the chance to use your time for yourself. So, one takeaway point that I would like to make from this is that it's okay to talk about mental health to your clients, to your supervisor, to individuals that you're supervising. It's okay if going to a therapist is what relaxes you and helps you with your mental health. It's also okay if it's binge watching a couple hours of murder mysteries, or it's okay if it's both of those things. You are multifaceted, so it might not be the same thing every day. Pay attention to yourself and your needs, and it will help you to be the best clinician that you can be. Feel free to comment below with what works for you to help you relax and how to take care of your own mental health. Now, in the name of mental health, I am signing off and I'm going to bed. Thanks everybody for joining me, and I'll see you next time on Jillian's Clinical Corner.